Welcome to IMCAS TV, 10 Minutes with Dr. Khoury, plastic surgeon. Tell me, we're going to talk about fat and lipofilling, and I'd really like you to share your experience working with fat and lipofilling, which is also known as free fat transfer, being used for both breast and augmentation, and also in breast reconstruction for contouring of the breast after reconstructive surgery. Can you explain what exactly is lipofilling and why you feel it's going to be revolutionary in your field?
Lipofilling is the process of transferring fat from one part of the body to the other. Fat is a natural filler. This is how our body contour is determined. So if we take it from one part, we change the contour in that part. If we can add it successfully in another part, we can change the contour in this new part. We've recently gotten to better technique, better tools, better understanding of what it takes to get it to survive there. So to really change the
survive from the extraction to the transfer.
Exactly. In the past, the procedure was considered unreliable, not practical. People thought it didn't survive because they didn't know how to do it.
Mm-hmm.
Now that we've developed the science and the technology, we can make it more predictable. And by getting that fat to survive at a new location, we really can change the body contour.
And a longer percentage of fat surviving the transfer, I'm assuming.
We can get better fat survival.
Mm-hmm.
So if we can really take it from here and make it survive there, this is the ultimate plastic operation.
Yeah.
We can really mold bodies.
Perfection.
Yes.
And what parts of the body do you see the best results with lipofilling procedures?
Well, whatever you need to change the contour, add lipofilling is beautiful. In the face, you know, as we age, we also lose some fat. So we realize that facial rejuvenation is as much a facelift as a face fill. So we need to add some filling. So in facial surgery, it's really a nice improvement. Most modern facelift procedure incorporates some lipofilling.
Yeah.
Now, in breast surgery, it is really revolutionary.
Yeah, that's what I wanted to talk to you, because that's really the new use of lipofilling.
Yes.
And how has the success rate been with that?
Well, for many years we'll talk, don't do it.
Don't do it.
Based on a dogma that had no scientific foundation, thinking that the fat will die, won't survive, will cause calcification. That was proven not to be true. Fat is safe. Fat comes from your own body. There's no danger about transferring the fat to your body. The thing is, you got to make sure it survives. You just take a syringe, boom, inject it, you're going to get necrosis. It's not going to work.
Right.
So we learned that you have to get droplets at a time, tiny little droplets, diffusely spread. It's a painstaking process. It takes craftsmanship. You have to be gentle in the process, and you have to realize that the tissues can only take so much.
Yes, yes. So it's a question of dosage, it's a question of nuance, it's a question of where to inject, how much to inject.
And how much the tissues can tolerate.
And how much they can tolerate.
Oftentimes you want a lot, but the tissues won't take it.
And I'm assuming it differs from patient to patient.
It differs from situation to situation.
A situation. And who are your patients? I mean, I'm assuming it's lumpectomy and mastectomy patients, but you're also using the technique to touch up irregularities?
The majority of my patients today, believe it or not, are women who have implants and want them replaced with fat.
Ah.
So we take the implant out and we put fat instead. And we can give them much better shape, more natural, and just about the same volume they had before, but completely their own self. So that's my number one application today.
That's interesting.
But by far, the best way to augment a breast would be your own fat,
Yeah.
if you can get it to survive. And the best way to reconstruct the breast would be not cutting it from one part of the body, but simply sucking it out and re-injecting it.
And re-injecting it. And how about using it to totally reconstruct a breast for a woman who has very small breasts or no breasts?
That's exactly what I do a lot of.
Yeah.
We actually stopped calling it
primary
breast reconstruction. Actually, I stopped calling it breast reconstruction. I call it breast regeneration.
Regeneration.
Because
It's
we're
a better word.
really growing it, and the patient feels like their breast is growing.
Right.
They have a sense like when they were a teenager and watching their breast grow. So
it's almost a more natural procedure and a process.
It's their true recovery.
Mm-hmm.
They regrow back the breast that they lost to cancer.
That's a beautiful thing. And concerns, risks, secondary effects with breast lipofilling?
Well, it's certainly less risky of a procedure than the bigger operation we
Yeah.
used to do before. It's also your own body, so compared to the foreign implants we put in, this less risk of extrusion, etc. So if you do it right, it's a very safe procedure. We do it under minimal anesthesia. It's outpatient. Remember, sir,
It's outpatient.
it's outpatient. Remember, the larger the operation, the more the risks.
The more the risk.
The smaller the operation. Now, some pundits claim that fat's going to cause cancer. Your own body
Your
fat,
own body fat.
harvest from here, put there is going to cause cancer.
Well,
That's
unless
pretty
it catches
far-fetched.
something in between, I don't see how that's possible. The, the lipofilling also can be used to correct deformities, cleft palates, hemifacial atrophy, etc. Have you ever experienced any examples?
It's a very nice way to correct scars.
Ah.
If somebody has a scar on the face, we can melt the scars away. I use it all the time to melt away scars. I actually treat Dupuytren contractures. You know, people have the contraction with fat also.
With fat.
I treat tendon adhesions with fat. All scars in the body can be made to melt away with nice, judicious injections of fat.
So we have reconstructive and aesthetic uses. Where could lipofilling possibly go in the future?
Well, this is something that was there in front of us, and for many years we were told, don't use it. And now that we have modern technology, we're using and realizing, wow, so many uses to fat.
Yeah. And what about new innovations in the field?
Well, we're finding that fat can do a lot of things. It can help, fat is not just our reservoir of excess food. Fat is our reservoir for a lot of things. So if you can harvest it and put it somewhere else, you can cause a lot of things to happen.
In a natural
things,
way.
healthy things.
Thank you so much, Dr. Curry. This is really interesting. Thank you.
Thank you. Pleasure.